Hello, I am Dr. Sarda, consultant gynecologist at Yashoda Hospital, Somajiguda. So today our topic of discussion is gestational diabetes. So nowadays we are seeing so many women getting diabetes. What is gestational diabetes? If the diabetes comes in pregnancy, it is gestational diabetes. So nowadays we are hearing so much about this. Every other pregnant woman is telling that they are having diabetes. So why so much of diabetes now? Why was it not there before? So even before, maybe it was there, but we didn't notice it so much. India, so the South Asian subcontinent, India, Pakistan, Bangladesh, is a hub for diabetes. We have a special gene because of the ethnicity, and so we get diabetes in pregnancy. So nowadays we are doing so many screening tests. So screening test is a test to detect before the disease has come. So we do a lot of glucose tests, glucose tolerance tests, fasting tests, so that we can pick up diabetes at an early stage. So first test is done at your 5th month. So if the mother has any risk factors like her parents are diabetic, she is overweight, the mother is overweight, or already had a baby who was very heavy, or have a lot of fluid in the previous pregnancy, or some mishap has happened in the previous pregnancy, then we do it bit early. That means in the 3rd month, or otherwise we do the screening test after the 5th month if there are no risk factors around 5th month. So fasting sugar is done, the mother is given a challenge of glucose, and then again after 2 hours another sugar test is done. So that's the way we see how the mother is able to handle the glucose load. If the values are a bit high, then we label the women as diabetes, gestational diabetes. And first step, so what happens if gestational diabetes comes? So gestational diabetes usually starts from 5th to 6th month. So by the time all the baby organs are formed, so there is no problem in formation of baby organs. But if mother is already diabetic in the first 3 months, there may be a defect in formation of the baby. But because this gestational diabetes comes in the 5th month, then it is that the baby's weight is very huge. So baby's weight increases beyond a level, and fluid around the baby is very high. So what if the baby's weight is high? It's a good thing, right? You get big babies. No, it's not like that. So after the baby is born, the baby's blood sugars go on decreasing. So baby will not be able to maintain sugars. There will be a lot of hypoglycemia to the baby in the initial days of adjusting, 2 to 3 days. The baby will have bit of jaundice. Baby's breathing will be a bit difficult, adjusting to the air breathing outside the womb. So that will be a bit difficult. So to control all these bad things after baby's birth, we have to control diabetes in the mother. And delivery of the baby will be difficult. So if baby is very big, normal delivery, there's something called as shoulder dystocia. Shoulder dystocia is after the baby head delivery, shoulders get stuck, and that's a very devastating thing. So these are some problems with gestational diabetes. So we have to treat this gestational diabetes. And how do you treat? So treating is always first thing a natural change in your diet and regular exercise. So maybe some part of it, then those who are on a borderline, by following a strict diabetic diet. So being very strict with their diet and a proper physical exercise for some days, and keep checking your sugars regularly. So most of the times they do good and they don't need any other tablets. But sometimes, in spite of being very regular with diet and exercise, the women might need some medicines. So medicines can be again some tablets, or if the sugars are a bit high, then you might have to use some insulin. So using insulin doesn't mean that you have a very high sugar and this continues after pregnancy. No, the whole idea is keep the sugars under control. So if you're not able to do with diet, there's nothing harm in taking the tablets or the insulin. The idea is keep the sugars under control so that problems to the mother and to the baby are decreased.